So welcome back. And today we have got one of the most trending subjects that is out there on social media at the moment, longevity. And whenever we talk about longevity, we always want the professionals on here to give their education advice with what's really going on there. So we've got today A&E doctor, Dr. Ed, welcome.
Thank you. Thanks for having me on.
You're very welcome. Thank you for coming. Who owns Healthy Clinics, the longevity clinics. So they're one of the biggest in the UK at the moment. So congratulations on that.
We're getting there.
It is, but you know what, hard work pays off as always. So thank you for coming. Obviously, you've done a long shift last night and you've still come here. So the longevity stuff is definitely working, as we say. So yeah, let's talk about the bigger picture of it all at the moment, because it is something in 2026 that we're really going to see blow up, as you can already see it trending at the moment. But obviously it has been going for many years. Just we're on this kind of health and wellness track, if shall we say, at the moment.
Yeah, I think everyone's promoting health and well-being.
Yeah.
Like you're seeing it everywhere, PTs, supplements, and it's like, I think Instagram's driven a lot of it, to be honest, you know, the aesthetic side of it.
Yeah.
But it's, for me anyway, a double-edged sword at the moment. I'm seeing a lot of complications from the stuff that's going out in industry. Because, you know, a lot of it's so unregulated, and I think I'm trying to do what I can, but to actually bring in some kind of regulation and call people out. Like I've actually started this like Missfluencer Mondays where I'll like every Monday I'll call like 5 influencers out for what they're doing.
Oh, I love that.
And like I'll message their agents and be like, what the hell are you doing?
Yeah.
Because like the advice that they're giving is wildly inappropriate. And I just think like, it's the same thing when you walk down like the aisle in Boots or Superdrug. I did it the other day, we were messing around with some social media stuff. And I think we found about 240 products that promoted energy.
Yeah.
Do you know what I mean? You walking everywhere and you're seeing like energy and boosting this, and it's marketing rubbish.
Yeah.
And I would say there's like 3 or 4 things that the majority of people could benefit from, but otherwise it's like, what are we doing?
Yeah. It's funny because, you know, when you said that you walk down Boots, I need to kick this habit, by the way, because I am non-stop on Red Bull. But I've actually noticed the past few months when I've been going to like the Tesco and that sugar-free Red Bull is sold out everywhere. So, you know, people are obviously drained of energy. So they are looking to outsource what they can do and obviously what they can take. And, you know, we've seen it in aesthetics, how unregulated that is. And I feel like what we're seeing now, because it's the next trending thing, you're seeing so much so unregulated within like this longevity industry and wellness, that it's just like, it's ludicrous that you've got people out there educating, and half the time I'm like, well, where are you citing this information from?
Yeah. I think they're all just trying to make cash. And for me, when we're looking at people's health, you've got to put the person's health first.
Yeah.
And the NHS gets a hard time. And I think we always slam healthcare institutions for like, oh, you know, the money-making machines.
Yeah.
But then the people who slam them are off selling supplements that don't work, that are filled with crap, and they're doing it to make money. And you're like,
what's going on?
It's mad.
It's true. And, you know, because where did I go? I went to the Barcelona, I think it's like, is it the Vitamin Foods and Supplement conference? It's one of the big ones. I'll have to think of the name and I'll put it in the description. But it can be overwhelming. You go and you're looking to see, oh, what's the next best thing that I should be taking or doing? And there's all these stores just offering different things, and you just think, well, where am I meant to start with it?
Yeah.
And I think that's the difference, isn't it? Whether you go to an influencer and take their advice, or you come to someone like you who's medical trained, know what they're talking about, and literally have moved into an industry where you can factually say, well, this is what works for your cells and recovery, your muscle fatigue, you know, gut health, because externally that's what's going to show.
Yeah. And I think the issue I've got with influencer advice is, well, they don't know their arse from their elbow with this stuff. But some of them do. But I think giving out blanket health advice is always a bad idea, because ultimately the individual, it's got to be so personalized to the individual. Yeah. Because everyone comes with their own set of problems, their own past medical history, the family history, different genetics, they're living very differently, they're eating differently, they're training differently. It's like, how can you, across all of those, it's almost like an infinite amount of variables, say, oh, you all need to take this one thing. What are you on about? Yeah. That's easy to sell. And that's where I think it comes from. It's like the extreme sell. I see stuff online where it's like, oh, all you need is pink Himalayan sea salt. It's like, Right, okay. I need to just do that in A&E. That'll solve everyone's problems. Imagine you came into A&E, everyone, and I said, there's pink Himalayan sea salt, off you go.
Yeah.
You'd look at me like I've got 7 heads. It's utterly ridiculous. But that's what's happening online. And same with like CBD oil. All you need is CBD oil. You're like, are you actually bevied? Absolutely not. That's not what you need.
Yeah. But I think it's when you see like people now linking CBD oil with, it can fix cancer. You don't need to go and get medical advice. Your cancer can go with because of CBD oil, and you're just like, but people are actually taking this advice and going down that route.
Anti-inflammatory things are obviously good. So like eating a good diet and exercising and sleep well, that is obviously good advice. But there are cases where you need chemo or you need radiotherapy. And the issue I've got is that people will promote these things as like, this is the cure. And it's like, there's very, very, very little evidence that it'll do it, and people die.
Yeah. But
and
this is it.
When they die, apart from their intimate family, like they are kind of forgotten almost because, I see people die all of the time, and I don't know, I just think we're not serving our populations well at all.
Yeah.
And I think what we need to do is like what I said before, which is treat people individually and offer very specific advice for each individual person. And the only way we can do that is with data.
Yeah.
And like understanding that individual and speaking to them as a person.
Absolutely.
And being like, okay, where are we? What are the problems? Where do you want to try and get to? And let's try and create a plan together.
Yeah.
That's the way that it should be, not pink Himalayan sea salt.
It's also, I had a friend and she rang me the other day and she was like, I've gone and had an intolerance test. So I was like, okay, so did they take your bloods and what did they do? And they went, no, I just held this piece of metal and they took the frequency and told me everything that I was allergic to. And I went,
cool.
Oh, okay. So your fingerprints and frequency told you that you were, and I went, I think you really need to go to a doctor and have a full blood count. Because she was like, well, I need to cut out dairy now. I need to cut out this. And I was like, so there's your nutrition now. You're not come away with any more nutritional advice than basically a piece of paper to say that that's what you're allergic to and don't eat.
Yeah. I mean, even intolerance testing, the blood testing, the evidence, or the hair testing, the evidence isn't amazing for it because it's not a pure allergy, right? So if you have an actual allergy, you will have an allergic reaction. But most people aren't having an allergic reaction. They're having symptoms. But intolerances are volume based. So if I went away and drank 4 pints of milk, I'd probably get the shits.
Yeah.
Do you know what I mean? Like if anyone went away and gulped a lot, you'd probably throw up and have diarrhea. But if you have a teaspoon, you probably wouldn't have too much effect. So intolerances are volume based, and that's where this intolerance testing kind of gets lost because it will say you're intolerant to X, but at what volume? So then people just cut it out entirely, and it doesn't tell the whole picture. It's a bit grey. So say they might cut out like peaches because it said, oh, you're intolerant to peaches, but actually like you can have half a peach and you'd be fine.
Yeah.
So yeah, I think the best way to do intolerances is to keep a food diary. It's hard because it requires effort. People want quick fixes. And I think we'll come on to this a bit more. Like people just want something that's quick and easy. Hence, it's easy to sell extremes.
Yeah.
It's easy to sell like, take this one thing and it'll solve all your problems. And intolerance testing is similar in that sense of like, oh, just do this one thing, it'll tell you all the answers. It's much harder to keep a food diary and keep a track of what we're eating, tracking symptoms alongside it. But then we can take into account volume, and then we can start to say, okay, when we've had 2 chicken breasts, this has happened. Do you know what I mean? So then we start to build up a bit of a picture. And I send it out to all my patients who are having issues, and they'll keep it for 2 weeks. I say, look, print it out, stick it on your fridge and track everything for 2 weeks and come back to me.
Yeah.
And then we can have a chat about it. Don't get me wrong, if they want to pay for intolerance test, they can do, but I'll say to them up front, this isn't the best use of your money.
Yeah. Let me ask, because obviously we're on about intolerance before obviously we do move on, because we've got some amazing questions to ask. Parasite cleansers and colonics. I've had one, and I felt for about 2 weeks whilst I was doing it, I did feel super, super tired. But then once I did have it cleared out, I did feel good. But where's your view on that as well?
There's not loads of evidence for them.
Yeah.
I think we sometimes give things akin to colonics, but it's if you're like constipated. I wouldn't say it should be routinely done.
Yeah.
You know, if you're completely bunged up, and there's different types of laxatives, there's different ways to like clear people out. there's like 4 different types of laxatives. So again, those colonics aren't necessarily targeted.
Yeah.
They're one form. I don't know. I'm not into these things because they are not that evidence-based. And also it should be specific to like, if there's a problem there, let's fix that problem and let's put the right intervention in place. But again, I think people are going for colonics for a completely different reason, which is I want to feel better. I want to try and like improve my energy, improve my health. Yeah. Is a colonic going to do that?
Well, to be fair, I'm not saying it was actually triggered by that, but I'd never had any problems in the past. And I did have this kind of testing done. I did a couple of colonics, I think 4 colonics within about 6 weeks, which was probably too much because probably I've moved bacteria, went into my appendix, and then 4 weeks later I was having my appendix removed.
Okay.
I'm not saying it's linked to it, but then I did question, have I moved too much good bacteria out me colon and then I've ended up with appendicitis?
Maybe. The thing with your gut is there's something called dysbiosis, which is the breakdown of the gut lining, essentially. So your gut has a layer of cells on it and a mucus layer on top of those cells. And that's what we call a healthy gut lining. We need that mucus layer on the gut because it helps to regulate what goes through the cells and into the bloodstream. Now, what we're seeing with people who are having like high processed diets and they're destroying the gut lining is that the mucus layer breaks down and then the cells underneath also get damaged. And we then get, rather than the cell junctions being tight like this, so if you've got one cell here and another cell there, they're butted up against each other like this. And it's what's called tight junctions. That allows your cells to then regulate what goes in and what goes out. That's what we want. If we start to break down the mucus layer, the cells get damaged. As the cells get damaged, they start to like fall apart like this, and then stuff can leak. It's called leaky gut syndrome. You might have seen that. But stuff then can pass through without regulation. Your body can't then regulate it, and it can pass into the blood. And we're seeing all sorts of problems related to that. So even linking it to things like cancers. So it's thought, it's not rock solid evidence, but around 40% of prostate cancers they think are coming from this kind of pathophysiology. So it is reasonable to assume. And then bacteria can cross over, by the way. So all sorts of stuff can pass into your blood because you're not regulating that gut lining. So the advice is we need to have ideally over 45 different veg per week. And the reason for that is I describe people's guts as like a rainforest. We need that biodiversity in the gut to have lots of different types of bacteria in the gut. And, people going for gut microbiome testing, my gut microbiome is going to be different to yours, but they both might be healthy. So if we took an acre of rainforest over here and another acre over there, but there's loads of biodiversity in both, they're both healthy ecosystems, but they can have different proportions of plants and animals in both. Does that make sense? So it's the same with people's guts. And this is why I don't think the gut microbiome testing is too helpful, because it's like you might have a really healthy gut, but who's to say what percentage of what bacteria is right? There's other ways to see if you've got leaky gut syndrome. So I don't think those microbiome testing is too helpful. But going back to the advice, over 45 different veg per week to build up that biodiversity. And ideally, we have around 6 grams of fiber per 10 kilos. For some people, that might be too much. Some people say between 4 and 6 grams. If you're going around 36 grams of fiber per day, you'll be roughly right. But all of those cellulose fibers that are in the plants and in the veg, that's what the bacteria are going to like feed on. And that's really how we build up good gut health. And that's where the focus for me should be is eating really good food.
Well, I think you're going to find everything improves from that, aren't you? Because, you've got your diet, your nutrition, your gut's in perfect tact. So that's going to come out on like your mental health, your skin. So everything then is going to kind of align better. And I think people are out there and are going for all these tests because of the kind of the fatigue, the skin and stuff like that, but not going to the right places for it. Now, if that was the case, someone's out there now listening to this, what would be the tests that you do that we could say, do you know what, go to Dr. Ed, have this done, because you're going to be able to, rather than going for these gut
microbiome
tests. And
one of the main things that we do is inflammatory marker testing. So they are non-specific, but I think that gives us, I never go deep down one system first. So I would never just go just down gut. We got to look holistically. We got to look at the whole person. So when they first come into clinic, we speak to them, sit down, go through all of the past medical history, family history, and so on, get a picture of who they are, go through the training, the nutrition, the sleep, and everything. Then we go, okay, this is the blood test that we'd recommend for you. It might be a scan, but I typically try to start with bloods because it gives us so much data. And when we're investigating gut, I do try to start with some inflammatory data to look at what inflammatory levels are present in the body. And I would love to do this stuff on the NHS, but the testing's not available because it is quite expensive to do it.
And they just haven't got the funding right now, have they? And, hopefully it's something that can come in, but...
Yeah, and I think the NHS is looking for something different. So I think they're trying to treat disease because we've got so much disease in the community. And we have an opportunity to create good levels of health outside of the NHS. The NHS could step into it a bit more, but it is funding issues. But yeah, I think we'd start with an inflammatory blood panel basically to look at, okay, what levels have we got in the body and what could the potential causes be? It could be gut, but it could be stress, it could be sleep, it could be poor exercise, it could be processed food. Yeah. There's all sorts of things that it could be, but when they first step into clinic, full history, get to know them, target the blood test, and then work out where they're at. Because only at that point, once you've got that information, can you then say, this is potentially where we might go. And then you've got to tailor it to them. So it's like, they might not be able to do X, Y, or Z because they've got 2 kids at home or I'm working like chaotic schedules, So this again is when you actually go into the detail, why those things that are selling online of, just take pink Himalayan sea salt is so wildly inappropriate.
What's the one I've seen recently? Take a tablespoon of bicarbonate soda and it's going to fix everything in the body. And you're like,
it's crazy, isn't it?
Okay, is this what we're really, really seeing right now?
Yeah.
With it all? Or it'll be, go and get on the Manjaro and it'll fix everyone. I'm just like, wow, is this really what level of bad advice that is out there for people? And people are just risking everything.
It comes back to they want a quick fix.
That's it. And unfortunately, I see it myself in clinic and that people just want to see results there and then. Yeah. They don't want to go the whole kind of like, changing the diet, changing the exercise, the lifestyle, not drinking alcohol as much. And it's just...
sugar-free Red Bulls.
Yeah, which I need to get out. So if you've got anything in that clinic, even if it's like hypnotization right now, I think I need it. So let's talk about obviously the £1,000 question and kind of out there, because obviously some things you do see and like they're saying, but I can't really afford a lot of these like kind of like things that are recommended out there and everything. So let's go talk a little bit about that.
Sure. So what if I had £1,000? What would I do?
Yes.
In terms of my health and well-being? I'd just get a blood test. I'd speak to a longevity doctor and I'd get a test because at that point we know what potential issues there are. The thing is, we can pick it up earlier in the blood than when it presents. Mm-hmm. So this is the ideal time to then intervene early. So like my work in A&E is frustrating because people have accumulated disease for so long and then they come in with something. So they come in with like a heart attack or a stroke.
Because I think that's what people don't understand. Like, all disease comes from inflammation in the body.
Huge components of it,
Do you get what I mean? Yeah. And I think you lower them kind of levels, a lot of the disease won't actually obviously accumulate.
Yeah, so 90% of chronic disease comes from lifestyle, which is huge, and people want to be healthy, of course, but I do think we live in a I don't like that word, but like we do live in a misinformation culture where you can't go see your GP. They're not necessarily the best person to speak to in terms of lifestyle either, unless they've cross-transferred and done the training in lifestyle medicine. It's around 4,000 GPs now who have trained in lifestyle medicine. So it is growing. It's the fastest growing area of healthcare, which is great.
I think what's great as well, because you're seeing the NHS pushing like social prescribing. So then you've got like doctors like yourself who are coming away a little bit and recommending other things than obviously going and getting straight on medication for something that can be fixed probably in a different way. Yeah,
definitely. And I think medications are important. I've just done a whole weekend in A&E and back in, hence the scrubs today. And, people attack Big Pharma and I get it. I really do. And I do think some of the practices are not the most ethical and I don't like those aspects at all. But there are medications that genuinely save people's lives and I give them all the time. And if someone goes into something called like flash pulmonary edema, where you get fluid on your lungs really quickly, we give them like water through the vein. We give them essentially like, water tablets, similar kind of stuff, but through the vein, and it offloads the fluid really quickly from the lungs, and then they don't feel like they're underwater and they survive. So it's like, these medications are amazing if they're used in the right way. So it's a double-edged sword, all of this stuff. But where I think the supplement industry gets it so wrong is they're deeply unregulated and anybody can sell them. Like, we could go away and make a supplement brand now.
Well, I didn't realise how unregulated it was until I went to this conference, and I was like, but these are food supplements, and they were getting away. It's like NAD, let's say. That's so unregulated at the moment, like, because they're getting away with saying it's a food supplement. But then if you're ingesting something, I know what it's like because I've got a skincare brand, and just to be able to put topical things on the skin, I had to go through huge regulation checks, safety checks. But then when I was at VitaFood, sorry, I couldn't think of it before, I was saying to them, so what safety checks do you have to go through to actually bring this to market? And they were like, oh, most of it's classed as food supplements. So I'm ingesting this stuff, but it's not as regulated if I'm putting something topically on my skin.
Yeah, it's crazy, isn't it?
I was blown away by it.
I think they're called edible products rather than like food. But yeah, again, people don't know what they're taking. And then there's loads of synthetic crap in there. There's like lead, and AG1's recently had a study where it's got 4 times the amount of safe lead.
Wow.
And people are, that's been promoted by influencers who have got good names, and it's come out that in randomized control trials, which is some of the best type of evidence, that it's got 4 times the amount of safe lead. And it's just like, it's rife everywhere, and it's being driven by A, I want a quick fix, and B, I want to make money.
And vulnerability, isn't it? Because obviously the misinformation of the patients, then like obviously the consumer, they haven't got the right information, so they think they're taking this supplement because they're shown this lifestyle. Yeah. But the health's ultimately at risk.
Yeah. It's £1,000 question. Going back to what we said, I'd spend 250 quid on a test, a proper test, sit down with a doctor and work out what my potential problems are, because then we can do future planning. We're not doing reactive stuff. We can pick up disease so early. So the tests, personally, I would get done. HbA1c. Yeah. Absolutely. If you don't know what that is, go away and have a look at it, because you need to understand that's your average blood sugar over.
I was going to say it's like glucose, months. Isn't it? To see because we do it a lot with diabetes. And
and the NHS target is to keep you under 42. I'm a lot more aggressive. I want you at least, like, ideally under 35.
Yeah, because my partner's come back about 39, and I'd just been doing it, to be fair, in uni, and I said, that's nearly like the high marker, that, and he was like, no, it's perfectly safe.
Well, the thing is, you're pre-diabetic at 42. Yeah. You become full diabetic at 48. And the NHS want you ideally under 42. But if you're 41, they're like, I'll see you later. Yeah. Because they're looking for disease. And like, there's people who've got HbA1c as 70. Yeah. Do you know what I mean? And in a finite resource, obviously we need to get the people with 70 and high 60s down quickly. Yeah. And the resource, unfortunately, does go there. So if you're at 39, then I'm asked.
Well, I was looking at a study, and I think the study was saying how much diabetes now costs, like, the NHS in the world, like WHO and stuff like that. Do you know what I mean? It's rising and rising and rising.
Yeah, and it's about 6 days per year of sick leave as well. So it affects productivity, affects workplaces, affects people's mental health. It's rife. And then, if end stage diabetes, your feet chopped off, you lose your vision. Like, it's not, you don't want it. And it can be controlled by diet. We're talking about type 2 diabetes
Type 2, because you've got type 1 that obviously, that's your is it your liver or your pancreas doesn't release it, so the cells can't take the glucose or something like that.
Yeah, exactly. You don't produce it, so you have to inject it. But yeah, so going back to £1,000, with 250 quid, I definitely get a HbA1c done and checked. I check mine biannually, Yeah. I would also do what's called ApoB, so apolipoprotein B. If you go to your GP, you will get a basic cholesterol panel, which is kind of helpful. But the devil's in the detail, because there's different types of cholesterol. So cholesterol isn't fat. It's technically a steroid. Yeah. Triglycerides is another blood test you can get, and that is fat in your blood. So cholesterol is a steroid, and it does contribute to plaque formation, but we need cholesterol, right? Yeah. So not all cholesterol is bad. But HDL is a type of cholesterol called high density lipoprotein. That's one type of cholesterol. You got HDL, which is the good stuff. I'm simplifying slightly. And then you got the LDL, which is the bad stuff, low density. So I describe the HDL as like small metal ball bearings that are inside your blood. Yeah. Okay. And they're dense, they're small. That's the HDL. The LDL is big, fluffy stuff, okay? And that can get stuck inside your arteries. And if it accumulates, if it builds up, it can form like plaques and it can break off and it can cause heart attacks, strokes, PEs.
So you're going to get like aneurysms and things like that, would you forming? Because obviously blood can't get through or...
Yeah. Aneurysms are slightly different, but it's in terms of like the end effect, it's very similar. Yeah. But the aneurysms are like kind of a balloon on the side of your blood vessel.
Yeah.
But yeah, you build up these plaque formations and they can break off. So the breakdown of the cholesterol is important, but your GP will do a HDL and LDL. Mm-hmm. But again, the devil's in the details. So the ApoB is the one that I would actually check. The ApoB is the protein that's attached to the LDL. Okay, so the LDL is the bad stuff, right? Mm-hmm. But the ApoB is the thing that's actually driving disease, and that's not getting checked.
Okay.
So
that's like your inflammation that's going to start rising, I suppose, in the blood cells.
Yeah, so it's like, it's the thing that drives those clotty things.
Yeah.
Yeah, so it's the atherogenetic particle is what we call it. So it's the thing that's actually going to drive those clots is the ApoB.
Okay.
We've also got an ApoA1, which is the thing that's attached to the HDL. Mm-hmm. So we look at that as well to look at how much good stuff there is.
Yeah.
So I do an ApoB, an ApoA1, HbA1c, and then there's something else called an LPA or lipoprotein A. I know these are ridiculous words.
No, but it's things that we want to know nowadays, isn't it? Because we are conscious, especially I'm 40 now. So, we can look okay externally, but internally we can be aging so much faster than what we look.
Yeah. And you don't feel these things.
Yeah.
They're just building up or potentially building up. Your LPA is like a genetic risk of clottiness almost. So we want you under 75 there.
Because you'll see it as well. Because I'm only seeing it from an external view when you're kind of listening to people talk, saying, "Oh my God, my friend's passed away. This passed away." And you're like, "Oh, how old are they?" And they're like, "Oh, they were 39, they were 37, they were 42." And I'm like, "Wow, people are getting younger and younger with heart attacks." And obviously, you're seeing it in A&E non-stop. And is it down to these lifestyle things that are creating them?
Sometimes it's unlucky.
Yeah,
but there's definitely a lifestyle component to it. And, some people are massively overweight. The other, again, going back to your £1,000 is getting your weight checked. Like we do a waist hip ratio and working that out. And also your blood pressure. These are very simple, cheap things to do. But yeah, a huge component of it is lifestyle. Some people are just unlucky. Not everyone dies from heart attacks. People get mixed up between a heart attack and a cardiac arrest.
Yeah.
Cardiac arrest is where you actually die.
Yeah.
A heart attack is a clot that goes to your heart. But they are treatable. I, over the weekend, probably treated, 5 heart attacks.
Yeah.
And they all survived. So, and they have decent outcomes moving forward, but I obviously give them lifestyle advice.
Because I suppose once you've got one cardiac arrest, you've got scar tissue then there, haven't you? So, you're prone to probably something else coming from it if you don't change your lifestyle. Yeah,
if you have a full-blown cardiac arrest, there's loads of different reasons that you can have that. A heart attack is one of them. So if you have a really bad heart attack, you can have a cardiac arrest and die. Obviously, when we're doing CPR and things, you can break ribs and cause further trauma.
Unfortunately.
But yeah, I think the thing with heart attacks is that if a clot gets lodged in the arteries going to your heart, that part of the heart muscle can die. Because imagine it's just pipe work. If you close off a pipe and there's no water going through or no blood going through to that part of the heart muscle, it gets no oxygen. So that heart muscle dies. And that's where you get the pain, where we're getting a lack of oxygen to the heart muscle. That's why people hold on to the chest because they're not getting blood flow. So a lot of the treatment is revascularization of that bit of the heart muscle to open up that flow again, to unblock the pipe. So it depends. There's different types of heart attacks as well. I'm not going to go into it.
No, of course. It's a whole different podcast, this one, if we're going into that one.
But there are lifestyle things you can do. So again, we'll go back to the £1,000 question. Blood pressure is another big one. So if I was to take it all back, I'd look at ApoB, blood pressure, HbA1c, and hip to waist ratio. Those are the things. They're so important, and most people don't know those things.
Well, to be fair, I've only just found that out myself. Is it hip to
waist ratio?
Waist ratio, I would never have known that without you bringing
that
up.
You can do it at home.
Yeah.
Do you know what I mean? A blood pressure monitor is £15 off Amazon.
Because I think most people just think, I'll get on the scales. I'm under that kilogram. I'm absolutely fine. But I suppose there's all different levels of things you need to be looking at really rather than that scale, isn't it?
Yeah. And that, if you look at those things, that has much more impact on working out how healthy you are than randomly taking stuff on, like, because again, it goes back, people want to be healthy, but we're doing the wrong things.
Absolutely.
So going back to the heart attack stuff though, what's interesting is I prescribe patients sauna.
Okay.
So there's something that we give called GTN. So it's a spray, you might have heard of that. It's a
spray,
spray
isn't
under
it?
the tongue.
I've seen that when in the hospital sometimes when it's been given.
Yeah. So that opens up, it's a vasodilator, so it opens up the arteries of small vessels, so it can open up the arteries that go into the heart. That's how that kind of works. It's an aim to get that blood flow back.
Yeah.
What's interesting is with saunas, we release something called endogenous nitric oxide, which nitric oxide is the actual thing that causes the vasodilation.
Okay.
So GTN is glycerol trinitrate. The nitrates, the nitric oxide is a thing that opens up.
So we're giving like the hormone, really, are we, to kind of trigger in the body?
Yes, you get endogenous nitric oxide release from being exposed to heat in a sauna. So what I prescribe patients is 15 minutes 3 times a week. If you can do that, you get that endogenous nitric oxide release, and it opens up your... You've seen it when you're on holiday and you get hot and all your veins pop.
You go bright reds, absolutely. Well,
but that's how it works. It's that endogenous nitric oxide release, and it's very, very good for like long-term cardiovascular health. So, as long as you're well hydrated, sauna's great.
Please go to the sauna. Don't be going buying dodgy GTN that's probably been brought from China.
Well,
somewhere.
maybe, that's it. But don't go in for like 40 minutes as well.
Yeah.
I did this thing at uni where it was whoever got the best room in the house, and it was who could stay in the sauna the longest. But everyone ended up passing out. But like, people do it now. They'll go in for like half an hour to 40 minutes, but there's not loads of evidence for that. Just do 10 to 15 minutes is like maximum benefit.
Go in, meditate in 15 minutes in the sauna. At least first you start. Okay, let's talk about NAD. And is it a miracle drug? What are we thinking about this?
I describe it as like polishing a sinking ship.
Yeah. I think a lot of people, because it's so trending at the minute, isn't it? NAD. Oh, at home NAD, this. I've had it intravenously. Don't worry, you get that jittery feeling when it goes in, don't you? And I have felt good off it, but I think it's like anything, isn't it? If your petrol tank's low on it, you need to be doing it continuously for anything to kind of...
Yeah, but most people also produce... It's a coenzyme in mitochondrial energy metabolism. That's all NAD is, and your body produces it naturally. So the idea is that if we give it, then it will help the mitochondria metabolize more energy. But to be honest, the evidence for it's not fantastic at all.
Yeah.
And it's more like
not
hypothetical.
regulated, is it, at the moment either?
Yeah. And NMN is like
precursor.
an Yeah, exactly. So, no, I would... Why? What are we doing this for?
Yeah.
And like, I don't know. There's so many products out there. What other synthetic stuff is in that product? What else is in the fluid that's going into your vein?
Yeah.
I just think there's so many other things that people are getting wrong. Like, if you have a sugar-free Red Bull, keep it on the theme, that's going to have much more detrimental impact than the benefit of the NAD or the NMN.
Yeah.
So unless you are absolutely optimizing every single aspect of your life and you actually understand your body, which most people have no idea, they haven't done
it's
ApoBs.
too complex.
But this is why we shouldn't listen to misfluencers online. Like, go speak to a longevity doctor, get your bloods, understand your body, and then make a plan.
Because like, even though like you've got all these doctors, like you say, half the time it's like you specialise, like nursing, isn't it? Like I specialise now in adult, but then I don't know half the stuff of a child's nurse because your specialist speciality is completely different. Whereas like yourself, you've gone on to do longevity medicine and stuff like that. You're always adding because the body is that complex. And I think that's what a lot of people don't realise.
Yeah. And it all talks to each other. It's way too complicated. This is why we need to work together, right? So like, I don't know enough about cardiology to be able to say like what long-term treatment somebody goes on post-heart attack, for example, if we use that example again. And that's why we have to work together and like seek advice of specialists and then my main job as a longevity doctor and in A&E is to kind of pull all of those opinions together. Yeah, bring it all together, sit down with the patient, like, look, this is all the information we've got. What do you think? And where do you reckon we go with this?
Yeah.
So,
but I think that's where the misconception when you see social media, isn't it? And you've got the influencers that they don't realise a big part of the NHS is collaborative care.
Yeah.
So when you're doing this and you're working with the body like longevity, there will be so much other collaboration going on.
Yeah.
But then you've got people that just not realizing that this is where I think the profession of medics in these industries now, like your aesthetics, your longevity, whether it be kind of like social prescribing, shall we say, like the respect needs to come back, because I think people think, oh, they're just doctors, they're just nurses, they're just this, and they'll listen to influencers more so than a medical professional. Because it's like we've lost this, it's like our knowledge isn't key anymore, shall we say?
I get you. I think it's probably politics, isn't it, that plays a big aspect of that. Like, I think people started not trusting the healthcare system as much during COVID.
Yeah.
But I think, you know, when you work one-to-one with people, they appreciate it and they feel heard.
Yeah.
So, you know, I think most patients I see feel very empowered and happy with the level of care that they actually receive. And, you know, like 80% of my job is just communication. If you can sit down with somebody and have a good chat and be like, okay, how are we getting through this? That's like 80% of my job. But yeah, I do think people fundamentally don't trust healthcare professionals as much as they did.
Yeah.
And that's another reason why they're going online and getting this shit advice.
Yeah. Well, that's why I love you're out there out in these influences. Like, literally. But let's go back, because you actually mentioned, and you're seeing it everywhere on Instagram, obviously down to the mitochondria. And again, people like say, I'm taking NAD for my mitochondria. And I'm like, do you actually know what your mitochondria is? So let's actually educate people on this, because it's everywhere at the moment, saying, you know, you need to fix it. It's going to fix everything. And
yeah. Okay. I won't go into the absolute detail, but there's something called the Krebs cycle. Or the citric acid cycle. People call it different things, but the Krebs cycle is what we call it in the UK. And if you go away and have a look at a diagram of it, it's how the body essentially produces its energy molecules.
Yeah.
And it's called ATP, which is the end molecule that releases energy. So adenosine triphosphate. When that gets broken down, it gets broken down into ADP, diphosphate, and a phosphate molecule. And what needs to happen is we need to re-add that phosphate molecule back onto the ADP for it to become ATP, the 3 phosphate molecules, so that can be used as energy again. The ADP can't be used as energy, only ATP can. So it comes down to that basic Krebs cycle. There's loads and loads. It's a big circle. It's quite a nice little diagram, but they've all got like silly names all the way around.
It's all coded.
Yeah, but essentially what that's trying to do is create ATP so your body can utilize that as energy. And lots of different things play into this. So this is why people take creatine, because creatine phosphate adds more phosphate molecules in. So if we can add more phosphate in, we're getting the ADP, and we can add more phosphate back onto it to create more ATP. That's like kind of like the mechanics behind creatine, and how creatine can help us exert more force or energy. And NAD is kind of like a precursor. It's a coenzyme that helps the mitochondria in helping that Krebs cycle. Essentially, is what it's doing. But like I say, the body is producing NAD anyway. Yeah. So it naturally does decline with age. And it's thought that if we give NAD infusions, that it can help with this process. But again, the evidence for that is very, very sketchy. Yeah. So I would advise people to focus on, you know, understanding the body and doing the basics well. But I would much rather, you know, if you have normal kidney function, I'd much rather you go into creatine, because there's loads of evidence for creatine. Yeah. Creatine's great, provided that you've got normal kidneys and normal liver, you know.
So kind of take a creatine rather than an NAD supplement is going to be...
How cheap is creatine?
Oh, I've got the bags of it in my cupboard with my partner, do you know what I mean? And he's given it me constantly. Yeah. But it's, like you say, it's proven. Yeah. When you think about it, isn't it? Yeah. So now we're talking a little bit more like about obviously energy, and let's go across the male, like obviously the testosterone and people's decline in that, and male health there. Yeah. Because I think that's a big one for males at the moment as well, isn't it? Yeah.
And there is a decline in male testosterone levels.
What's causing that? Is that lifestyle again?
Yeah, mostly.
Environmental factors or?
Yeah, mostly lifestyle. So obesity, bad sleep, high levels of stress are the big ones, to be honest. I run a TRT clinic once a month, and it's a lot of middle-aged guys who are high performers in their career, but they're stressed out to the nines. They've got kids. They're trying to go to the gym. They're a little bit overweight. They're not sleeping very well because of the stress levels. And it's like, that's the picture that we've got.
What would be the first symptoms for a male to start recognizing with this then, if they were thinking, oh,
yeah,
God,
it could be low energy. It could be poor libido. It could be brain fog. They're all kind of soft symptoms is what I call them. You know, it's easy to miss them.
Yeah.
But they're the kind of things that they would get. Like no sex drive's a big one, to be honest. But again, what they need to do is, they might not have a testosterone deficiency. That might be fine. But we need to go on to TRT, to go on to testosterone replacement therapy. We need to have some kind of hypogonadism. So like we need to have a genuinely low testosterone level.
Yeah.
And we're not going to go into it because the mechanics of it are a bit complicated, but they need to do a full blood test to look at total testosterone and also free testosterone, because for every 100 particles of testosterone in the body, only about 2 of that 100 are what we call free. The rest of them are bound to proteins, and most of them are bound to this thing called SHBG, which is sex hormone binding globule. So again, devil's in the detail. It's complicated. But we need to check the PSA for the prostate. We need to check the prostate health. We need to check their albumin levels, which is a protein produced by the liver. If you don't do because I see lads in the gym who are going on to
unregulated. This is what I mean.
They're going on to TRT, and it's like, they haven't checked the prostate, they haven't checked the liver. Like, it's wild.
Because that must be so concerning to you, because like if someone's levels are okay, but they're then adding more of this hormone. What is it quite detrimental? Because obviously you're then adding unregulated medicine, because you're not going to see a doctor, you're just getting it off someone in the gym. You don't know where it's coming from.
There's so many issues, but let's say lots of men have prostate cancer. Okay, so the stat is 60% at 60, 70% at 70, and 80% at 80. It's very common. Not all of that's malignant, some of it's benign, but it's very, very common. If you don't get your prostate checked and you start TRT, there is evidence there to say that the testosterone can help grow that tumor. Okay, so all men need to go and check the PSA, get the prostate checked out. They also need to check the liver and get, do the SHBG, do the total test, speak to a doctor and do the blood test, because unless you do those things and if you go straight in and start it, you could be helping grow
the cells
cancers.
Honestly, I see it all the time, and even like girls, I'm on this growth hormone, and I'm like, but have you been checked? Because you're going to take this growth hormone not knowing if you've got any dormant cells in your body, and not knowing, because what that's going to do is just literally accelerate anything to grow. People
are doing it because they want to be healthy. They want to, but they're doing it completely the wrong way. Test first and then replace. We have a mantra in our business, which is test, replace, and test again. Everything that you need, everything that you do needs to be sandwiched with testing, because otherwise, how do you monitor impact?
Absolutely, it's back to that £1,000 question again. Are you going to put £1,000 to go and do it healthy, or are you going to risk it with Russian roulette, not spend it, and then down the line, it's detrimental?
And these things aren't cheap. Like, I probably get 10 to 20 questions a week from different people online about BPC 157.
It's everywhere at the moment. We need to probably beep that one, because I nearly had my Instagram took, because obviously it's at the moment Instagram's really going down a regulatory, which is good. It's really regulating anything that's kind of, like these peptides are being spoke about. But I'm glad that we've come onto it, because what you're seeing at the moment is people taking it, they've not seen a doctor. Or anyone who's trained in it, and you're just like,
they don't know what it is.
This is what I mean. It's just, again, it's like, oh, my mitochondria isn't working, so I'm taking BPC 157.
Well, they think, oh, I need to help myself with recovery, so I'm taking this thing from Steve at the gym. Sound?
I'm so glad that, because it's a big thing at the minute that people are jumping on and not kind of being aware of.
My problem with the peptide scene is that, peptides are just a small protein anyway, so it's given like this name, and everyone's peptides. It's like, they've been around forever. But, okay.
Well, that's it, because we had a scientist on, I think it was last week, and she's like a research scientist and she's been dealing with peptides, because there's millions of them, isn't it, in the body, and people don't realise. And she was saying, like, even the amount of like research has been done to this stage, they probably won't get regulated for another 10 years, because we just can't produce the evidence with them.
Yeah, it's really hard. My fundamental issue with them is that it can help with so the idea behind them is to help with angiogenesis, okay, which is like the formation of new blood vessels. So like if you have an injury, hypothetically, if we give you these types of peptides, then it can help form new blood vessels and revascularize that area in order to get more blood flow, more nutrients, more oxygen into that muscle and help it recover. That's kind of like hypothetically why people are doing it. What about cancers? What if you've got cancerous cells in the body?
Yeah.
Because you're taking systemic peptides, right? You're taking it and it's non-specific. So they're forming new blood vessels potentially everywhere. It can't target. They don't have the science yet. Maybe in the future we can, but at the moment we can't target individual tissues.
Yeah.
So we can't say just muscle cells are going to get targeted here or tendons or something like that, you know? So it's non-specific, and what if it helps revascularize a tumor?
Yeah.
You know, a tumor that you don't know you've got.
That's it.
You know, testicular cancer's big in young men, prostate cancers we've just talked about.
Because what people don't realise sometimes, them cancerous cells can be living there for up to 10 to 15 years and you not know it's been there either, can't you? And then it's something triggers it.
And then you could just give it a load more blood vessels and off we go. You know, well done.
Exactly.
Yeah, so I think peptides are a double-edged sword. And for me, let's just go back to basics again. Let's focus on lifestyle intervention. Stop wasting your money on this crap and just do the basics really well. So
no, absolutely. So CBD, is it helpful or hype?
Mostly hype.
Okay.
Yeah, it can be helpful.
Yeah.
There's a lot of evidence for it in anxiety and epilepsy. Beyond that, it's kind of like meh. People love to promote it because, you know, they can make money from it. But yeah, there's not loads of evidence for CBD, really. There's mixed evidence for sleep. Huge components of it are placebo. You know, if I gave you a glass of water and said it'd help you with all these problems, but I didn't tell you what was in it, it would help you problems because of placebo.
Yeah.
And that's a huge component of what we see with CBD. One, I have a big issue with people who promote CBD because they say, oh, I fully understand this compound. And it's like, no, you don't.
Really?
There's something called cytochrome P450, which is one of the main enzymes in your liver that helps break down things. Some people even call it like the detox enzyme, right? Because it helps to break down drugs and all sorts of stuff. CBD interferes with cytochrome P450, right?
Okay.
So the people who are selling it love a detox. They're like, oh, you know, I need detox this and detox that. Okay, sound. But you're also taking CBD, which ruins one of the main bloody detoxing enzymes in your body. So the whole thing is just this huge dichotomy.
It's bullshit,
it's absolute horseshit. So it winds me up. But if you use it genuinely for like chronic pain, epilepsy, anxiety, and it's targeted, there's evidence for that. There is not evidence for taking it globally. And because, you know, most of it's placebo, it interferes with enzymes.
The best for me is my dad or auntie's got cancer and we've gone to see Joe Bloggs round the corner. He's given me CBD oil and it's cured me.
Yeah.
And I'm like, really?
I know.
And it's just like, wow, people are just putting people's health at risk daily.
Yeah.
When you think about it.
People feed off it as well because there's that distrust of doctors that we talked about.
Yeah.
They then lean on this anecdotal data of like, oh, it's cured me. And people will feed into that. And then, you know, there was a story recently about this woman who lived, I think she was down in Cornwall. And I think she said she had cancer and she was doing all this like nature inspired detoxing things.
Because I think they think, oh, it comes from the earth. We're able to take it. And it's just like, okay, there's plenty that comes from the earth, but I wouldn't go and take them. Yeah.
She had a best-selling book. I think she sold like 4.5 million books.
Wow.
And people started following her advice and she made the entire thing up. I think she's in prison now. I can't remember her name. I need to find out. I'll send you it so you can put it in the link. But that is the kind of anecdotal bollocks that people buy into because there's that distrust of healthcare. They're like, oh, this woman solved all of these issues by doing these things. 4.5 million books later and probably countless people dead.
Yeah.
You know, she's now in prison. It just baffles me.
But the thing is that they get the ride off the back of it. Do you know what I mean? Because they get these cult followings and you just think, what the hell?
I know.
But I think it's good that you have got people now from the NHS. I think it was back in the day, we just stayed in our scrubs. We didn't really do anything. Whereas now we're like, no, we want to educate the mass.
Yeah. I think what's hard is I get in trouble quite a lot for doing this stuff.
Yeah.
Like I nearly lost my job at one point
Because the councils,
well, GMC stuff and
stuff,
because they often don't like doctors stepping out their line kind of thing. And but I think there's certainly a lot more acceptance now with something called the British Society of Lifestyle Medicine. They're regulating lifestyle medicine, and you can cross transfer as a doctor and do all those exams, which is brilliant. So there's a bit more acceptance now to be stepping into these realms.
And I think it's probably as well for the NHS as well. They're probably thinking we need our own to stand forward a little bit because the amount it is costing the NHS.
Yeah.
And that's what people don't realise. They're taking these GLPs, ending up in A&E, nearly dying because the glucose levels.
Or they got pancreatitis.
Do you get what I mean? And you're just like, people aren't realising the detrimental effects of it, or they're going to Turkey, coming back, and it's like they've got sepsis or they've got this, and it's like, oh yeah, I just went to Turkey, and it's just like, oh my God.
Yeah.
It needs to stop, doesn't it? Because it is, I think Instagram sells a lifestyle but doesn't sell the actual facts that if something goes wrong.
The thing is, I think it's not sexy to sell routine and discipline.
Yeah.
It's sexy to sell a nice green powder that you shake up every morning and post a picture of.
And watch and show your pre-Pilates body off with it. Do you know what I mean? This made me achieve this.
And with your nicely done up nails.
Yeah, do you get what I mean?
Yeah.
So let's talk about microplastics and environmental longevity, because I've never heard about this, so I'm quite interested to.
Sure. So I think one of the biggest exposures people need to avoid is BPA. Mm-hmm. So get yourself like a metal container or glass that's BPA free, and try not to heat anything in plastics. If you've got like Tupperwares or whatever, you shouldn't really be heating. Well, do not heat anything up in plastic.
Yeah.
Takeaway tub, if you're getting a takeaway or whatever and you reheat the next day, take it out of that tub, put it on a plate and then reheat it.
Yeah.
Those plastics can leak into the food. The other thing that you can do is...
I actually seen a doctor on... I think it was this morning, last week, and he was talking about actually something similar from pans.
Yeah.
There's things in these, is it the pans that you put on these induction ovens now? Yeah. And he's saying, go back to your like stainless steels, the ones that burn and everything, because they're a lot more safer.
Yeah. To be honest, I just use cast iron. I've just got Le Creuset stuff. Like it's got enamelled surfaces and like, because it retains heat really well. I find it cooks the food better.
Yeah.
And lifetime warranty, I'm not promoting Le Creuset. You can buy whatever you want, but yeah, you don't want those things like filtered into your food either. I think the other big thing is filter your water. So there's a lot of like microplastics in water. Depends where you are in the country. People have got different opinions about fluoride and whatever, but I do have a filter tap in mine. This alkaline water thing is a load of bollocks.
Another biggie one, isn't it, that's out there, our water's going to cure you, and you're like, okay.
Yeah. And the reason being is that your body regulates its own pH between 7.35 and 7.45 if you're outside of that. So yesterday in A&E, I did about 12 blood gases on people.
Yeah.
And again, today when I'm in, I will do blood gases on people where we look at the pH of the blood. Your body regulates that through kidneys and lungs primarily. And if you step outside of that range, it can kill you really quickly. Yeah. And I need to get you back into range quickly. Why the hell are we getting alkaline water? Like also the acid in your stomach's like pH 2 to 3.
Yeah.
So as soon as you drink that alkaline water, it's going to be neutralized anyway. So just drink normal filtered water. You don't need to spend $2,000 on this bloody pH.
Filter tap or something like this that people are promoting.
Yeah, even like a BPA-free Brita filter is decent, and they're about 30 quid. I have got an under the sink one, and the refills, I think they're like £20, but the actual installation was, it came with the house. So I was quite lucky in that respect. But, the filters are 20 quid to replace them. But you don't need all singing, all dancing $2,000 or $3,000 filters, get something which works. But yeah, filter your water. Don't heat up plastics. Try and get BPA free vessels.
Yeah. Because you're finding with all this, is this why we're seeing increase of inflammation in the body and diseases coming in?
Maybe. I think it's definitely a smaller component, but it's an easy win, isn't it? So you can buy. It also helps the environment if you're using like containers that last for ages. But I think the thing that's really driving disease is nutrition, lack of fitness, poor sleep.
Yeah.
This definitely plays a part, but it's much, much lesser. We need to do those things, the big hitters. But this is a nice to have. Like it's an easy win.
I love that you've gone on to obviously blood gases, because I lost my mum to COPD. Obviously, she was from the era of the big smokers, and then she went on to obviously vaping. And, it was detrimental to me watching her go through it, do you know what I mean? And constantly looking at her gases, and obviously it was detrimental to her. So we've seen the rise in kiddies and people vaping non-stop, and like they think it's a healthier version of smoking, and some of the effects of that. What's your thoughts on? And
I mean, it probably is healthier than smoking, but they haven't been around for that long. So in terms of like, who knows, over 50 years, I don't know. I don't think anyone really knows.
Yeah.
And it probably is better than smoking, but why do it?
Yeah.
Like
it's like a trend thing again, isn't it? It's like you see people just walking around with two of them like this, and you're just like.
I think the big thing for me is what's in the fluid. So we're already starting to see like the heavy metals in the fluids, or the batteries as well, and getting deposited in the base of the lungs. So that's being linked now with like bladder cancers and already, they haven't been out for that long, and we're already starting to see like bladder cancers going up. So I think just obviously smoking that shit's not good.
Yeah.
It's not rocket science. But as to the long-term effects, I can't really say too much else because the evidence isn't really there.
Yeah.
You get fluid on the lungs,
yeah,
or you can even get like a collapsed lung secondary to these things.
Yeah.
So, and that is stuff that I've seen in A&E as well. And then if you've got a collapsed lung, sometimes you have to put like a tube in the side of you to like reinflate the lung.
Yeah.
It's obviously rare, but it still happens. So just don't do it.
That's it. Especially the kiddies that you see. And I go past the high schools, and there's like 13, 14-year-olds with them in their hands, and you're just like, wow, it's crazy.
And they're also addicted to the nicotine, aren't they, as well?
Yeah.
Then, like.
So let's bring it back now, how they can get back healthy with exercise and the real, obviously, longevity lever with real exercise. Because obviously you've seen a lot of people go into extreme exercise routines at the moment, like high rocks, is it, and stuff like that. And I think, God, that must have such impact on the body. Like, what's your thoughts on healthy exercise that the body needs? And
so the most, it's hard because you do need a bit of everything. But if you were to strip it all back and just pick one, you'd pick strength training.
Yeah.
Because the thing that we want to do, bone is active tissue, right? So the long bones in your leg, we remineralize the bone when it's stressed. So if I got your bone and tried to bend it like this, it would remineralize, or at least stop the degradation of the bone tissue. So as we age, past the age of 30, bone tissue is gradually getting thinner and thinner and thinner. That generally happens with muscle as well, unless we do something about it.
Yeah.
And the way that we can actually stop doing that is through heavy resistance training. So if you do squats, imagine I've got a weight on my back now and I squat down, my femur, my long bone in my leg is having to take a huge amount of stress.
Yeah.
So that will stop the bone from thinning if I do that throughout my life. And like when we get people in their even early 50s, they can fracture the hips. When you say hip fracture, it's actually this long bone that fractures at the neck.
Yeah.
And by doing that heavy resistance training, we're stopping the bone from degrading, essentially from thinning out. So I always say we need to be strength training three times a week. High rocks and stuff, so it's obviously healthier to be doing that stuff, but my focus really is on the strength training.
Yeah.
You do need your cardio, but about 80% of your cardio should be in what's called zone 2. So that's much lower impact than the high rock stuff. So some people can even get in there with a fast walk. So your zone 2 is based on your heart rate. So if you've got a wearable, be able to track your heart rate, and everyone's got different zones. But it will work out your zone based on your max heart rate, and we work backwards from there. So zone 2 is kind of like the exercise that you do where you can hold a conversation. So the easiest way to measure it is actually walking around, or like it might be a light jog. Can you hold a conversation? That's probably zone 2. If you're running a bit harder and you can't hold a conversation, you're working a bit too hard, you might be stepping into zone 3 or zone 4. So about 80% of our cardio should be zone 2. 20% can be high intensity stuff like barries or high rocks or that kind of stuff. Or, but yeah, if you're just doing that one type of exercise, because I see people that all they'll do is high rocks, and that's not good. That's not healthy. It's better than being sedentary, but it's not holistic enough. Again, it goes back to being holistic. We need some good zone 2. We definitely need our strength training. We need mobility training. We need flexibility stuff. So we need that holistic picture, because high rocks is basically all endurance. And it's like, we need to be doing those super heavy lifts. There's no heavy lifting in High Rocks. You know, you need to be putting 120 kilos on your back and doing some squats. So part of our programs is everyone who comes through gets a full fitness plan, and I'll tell you exactly what your squat target is, exactly what your deadlift target is, the major compound movements, and then planning it across the week, every week. It's for the rest of your life, and then giving them targets around the zone 2, the high intensity stuff, the flexibility stuff. So again, it's holistic.
And then would that be different as well for a male and a female? Obviously, would you be a lot more
different targets?
Yeah,
but you know, even the advice I give to a 90-year-old lady, we're getting them off the Zimmer frames, and we're like, you know, the mobility's coming back because the bone's better and the muscle's better. We're preventing the muscle breakdown. So they can stand up by themselves, they can mobilize around the house. And some people don't think about this stuff because, like, oh, I'm 30 and I'm going to my Pilates classes and getting little flat weights. Like, great. But eventually,
to be fair, that's me at the minute, Dr. Ed. I'm obsessed with the fashion at the moment.
Yeah.
Do you know what I mean? And I think a lot of people just don't realize just how important the fashion, it's a big piece of organ. So I do a lot of like flexibility and like kind of releasing of like kind of fascia and stuff like that, because I feel like that, if that's mobility, like it's hydrated and mobile,
that's great. And make sure you do your strength training. So like,
I suppose it's keeping muscle integrity then, isn't it?
You've got to hold on to your muscle. So it's it's like the most metabolically active thing in your body. So when we're looking at controlling metabolic health, going back to the HbA1c and controlling blood sugars, if you've got more muscle in the body, you're going to control that a lot better. So you don't lose your muscle. If you lose your muscle, like around your joints, and you fall, your fracture risk goes up massively.
Of course.
Have you seen little like old frail people? You fart on them and you break the bone. So like,
God bless him, it's true though.
I know, but then mobility's after that. You know, the bed back. My granddad's 97, bless him, and he had a fall. I was on to him for years to sort it out, but it's hard to change people's behaviour.
Absolutely.
And he had a fall, broke his hip, and then since that point, he was fiercely independent up until he was like 93.
Oh, they say, don't they, once they stop their little routine, they start to sit down and everything goes downhill for them.
Yeah, and he'd tinker on his motorbike, and he was a French polisher, so he'd always be French polishing old clocks and stuff, and he would just tinker around his house, but he fell, broke his hip, and now he's been in care, and he hates his life now.
God
bless him.
him.
I know, and it's poo. But I think, like, had he not lost as much muscle, the thing with holding on to your muscle as well, you maintain reactivity. So if you trip over now, you just stick your leg out. Because you've got the type 2 muscle fibers to just stick your leg out. You don't even think about it. So you don't actually fall over. But if you lose your muscle mass, you lose those type 2 fibers. You lose that quick reactivity. So often it's not even a balance issue. It's a reactivity problem. So they lose the reactivity of the muscle, they trip over, and then they fall. They've got no padding around unless they're really fat, but they have no padding around the joints, and they break the hip.
So in terms of, obviously, because I do a lot of like yoga, so I'll do a yin class, I'll do an ashtanga to raise obviously my heart rate a little bit. So I'd probably need to do a bit of strength training in there as well, a couple of times a week, would you say?
Definitely, yeah. 2 to 3 times a week. Doesn't have to be long. But I would do your major muscle groups. So I'd do squats, deadlifts. As a lady, you don't have to do as much of this, but I'd still say do your bench and pull-ups if you can, or assisted. But with that, you're hitting the major muscle groups. You can do RDLs, you can do hip bridges, but you're hitting the major muscles of your entire body. And there's a lot of stabilization that goes into that as well. But that's great for all the muscles of the back, maintaining good posture. It's great for the leg muscles, front and back. It's great for the entire skeleton and overall muscle mass. So I definitely do 3 times a week. Half an hour sessions, doesn't have to be major, but that would be my focus. That would be the priority that I'd get right first. And then everything else, they're good. Like, we need those things. But if you don't do resistance training, for me, that's a big red flag. So.
You've got, I suppose it all goes hand in hand. And if you've got your strength there, you've got your active and like obviously your calm and kind of muscle groups then, haven't you? Okay, let's talk about influencers and the dangerous advice. We have touched on it, but I feel like we need to do a really good talk about this and like what should people be looking out for? Because unfortunately we are in an influencer world, aren't we? And I think come across to like your doctors and your people who have studied it, that them be your influencers.
I think my job as a doctor is around not giving dead straight answers because there's never a dead straight answer. If you get a dead straight answer, that should ring alarm bells in your head.
Well, it's like when you go into hospital, isn't it? For instance, you're getting tested for diabetes. There'll be so many different diagnostics before you'll give an actual diagnosis.
Yeah.
Before we go, okay, this is definitely what's wrong with you. And I think that's what people forget. Like, but then you'll take someone's word on the outside.
Yeah. So I'm trying to think of a case that I had yesterday. So I had a guy and I think he had new onset confusion and there's multiple reasons. I could have said to him, it's definitely this one thing.
Yeah.
Right? I could have given him that certainty, which influencers do. They'd be like, that is the absolute thing that it is, right? That is appalling practice. That should be major red flags.
Yeah.
He comes in with new onset confusion. And with that, you have to go in and try and work out, there's so many different causes.
Absolutely.
He ended up getting a scan of his head, which was inconclusive. So then he got referred to the medical team and we had to potentially do further scans. Well, we did do further scans. We did MRI scans, but he got a full confusion screen on the bloods, urine samples. We did the whole thing and really dug into his body. And at no point did I give him any level of certainty.
Yeah.
But I communicated clearly with him, being like, hey, look, this is where we are. When he was really confused, the family were involved. It was actually really concerning because he drove himself in. He'd recently been on holiday in America, but he had no recollection of it. He thought it was 1974. He didn't know like where he was, but he drove himself to hospital, which I took with a pinch of salt. I was like, there's no way this fella's driven himself in.
You could have easily said it's onset dementia coming. Do you know what I mean? And it's just like...
it could be delirium. It could be all sorts of stuff. But his car was genuinely in the car park, so God knows how he managed to get himself in, bless him. But then all of his family turned up and, we did a deep dive into his health, but at no point did I say it's definitely this one thing. And I think that's where influencers are incredibly dangerous to say, this is the thing that you need. Major, major red flags, like shut up.
Yeah.
Stop saying what you're saying immediately. I think we need to go into the patient, find the actual problems and then say, look, it could be this. It could also be this. I'm looking at all of these things and we're doing these tests because of these reasons.
Yeah.
And then all you do is you knock the pins down. So you're like, okay, we've done this test. It's not that thing. We've done the test. It's not this thing.
Yeah.
And then you're left with like, it's called a differential diagnosis for a reason. So I'll have like 10 differentials. It could be this, could be that, could be this. And I prioritize it in my head. Like this thing is going to kill them quicker. That number 1, number 2, number 3. And we prioritize it in terms of severity and we knock them out in terms of severity. So, okay, it's not a stroke, bang, that's gone. Okay, great. What else could it be? Oh, could it be an infection? Okay, that's gone. What else is it? So we're going through these things systematically and we have a differential diagnosis because we're open-minded to what the problem could be. And that is the fundamental difference between a doctor and an influencer.
And this is it. And I think, but we've got to, I feel like this way now, kind of these platforms that I won't name one of them because probably I'll get shut down if but this is where I feel like the regulation and duty of care needs to come in because the likes of you and I, if our duty of care isn't there, we're going to get struck off. Do you know what I mean? Because obviously we're not prioritising the right advice, shall we say? But then you've got these influencers and they've got these huge platforms to be able to do it.
And they're unregulated. Nobody's regulating them. Yeah.
Whereas
there's no consequence to the shit they chat.
Absolutely.
Yeah.
And you just think it's so detrimental to someone. Look, if you want to go and do like a review of a mascara and something like that, absolutely fine. But when it's someone's health.
Yeah, agreed. Also, what really frustrates me is they'll be on stuff. I see guys juiced to the nines and they've completely fucked their entire hypothalamic pituitary gonadal axis. Everything, they've got hypergonadism secondary to the amount of steroids that they're taking. But they'll say, this one supplement has allowed me to get these results. Yeah. And it's like, no, it hasn't. It's because you're injecting every other day. Yeah. So, yeah, I just think, but they won't admit online that they're on stuff, obviously, because they want to make out that it's all natural, but people are doing stuff behind the scenes where you have an unrealistic, and it's aesthetically driven. They'll be stood there with the tops off, or you'll see girls in the gym filming from behind with big bums or whatever, and they might have had bum filler, which is
another topic exactly you could go on with,
But like the aesthetics industry now and this like image that people want to try and get to is what I feel drives a lot of health behavior.
Well, I think what it is, I think we're dealing with a lot of body dysmorphia, a lot of mental health. And then what it comes down to is rather than internally going and saying, okay, I'm going to go and do something that can internally fix me before I change the outer world. Because I think if the internal world is actually focused right and, it's healthy, it's aligned, you're not going to go and do half this stuff on the outside to your body.
Yeah.
And I feel like that's where the aesthetics industry needs to change now. But I feel like what's happened with the aesthetics industry, it's become so kind of over consumed, shall we say, that now everyone wants to come across to wellness. So they're kind of giving now the wrong advice in wellness. And it's just like, it needs really, really kind of regulating all around.
Yeah, it's hard, isn't it? Because I feel as though if the government tried to regulate it, then the same people who don't already trust the government would say, what are they doing now? They're trying to shut me down.
This is exactly what's going on. Do you know what I mean? Now I can't feed my kids. Now I can't do that. And it's like, no, you can, but just go and do it ethically. Just go back to uni for 3 years, you know, and kind of come across. Because I feel like that's the difference. When you do come out of uni, your practice is completely different because you ethically think different. Do you know what I mean? So when you're going to go do a treatment and I've got an 18-year-old girl coming in, her lips are like that, I'm a bit like, okay, let's bring it back a little bit. Why are we doing this? Yeah. We're doing this because you're influenced by the outer world of what you're seeing on Instagram. You're being sold a lifestyle. That's what you should look like. And it's
good
just,
that you do that.
It needs to be done, I think, because if we don't, you are going to get... and I lose a lot of patients because of it, but I'd rather stick to my own ethical practice.
Yeah, it's hard, isn't it? Because somebody else will do it.
That's it. And it's something that I'm going to really start driving with it as well. Videos of like holistic care and, mindfulness before we go and start injecting the face and looking not like ourselves, shall we say.
But I think this is where, who's the guy from Friends who died in a hot tub?
When he was getting...
Yeah, he was getting stuff prescribed privately, wasn't he? What was his name?
Yeah.
Matthew Perry. Thank you for that.
Obviously, we know that the drug starts with a K, but I'm not going to... We'll bleep that one as well because obviously
but it's important to talk about.
Yeah, absolutely.
And I think the mentality in America is, if you don't prescribe it for me, I'll go find...
elsewhere.
Yeah, I'll go find another doctor who'll prescribe it for me. I think that's such a dangerous kind of rhetoric to have because actually... it might not be good for somebody to be continuously on that thing. And people do, unfortunately, die secondary to these things if it's done inappropriately. So I think we do need to regulate it. And I think the ethics of the healthcare professionals needs to be respected because ultimately we are trying to look after the people. There are cases where Shipman and who's the one in Chester? Oh God, Lucy Letby and things, terrible things do occasionally happen. But I think generally across the board, we are here to look after people and support people, and that does need to
because
be
I think
respected.
that's where it is online. Because I was looking at this and I was thinking, where has the respect gone? And I started to listen to patients, and they'd be like, "Well, you're medics and you're pushing but your prices are too high." And I'm like, "Yeah, but you don't understand what comes with that." Do you know what I mean? You've got your premises, you've got your insurance, you've got the actual product that does cost, unfortunately. You've got your prescription
CQC
fee.
fees.
Absolutely. And the list goes on because it's being done ethically, right? But then I can go and get toxin from down the road with £100.
Sound, go and do it.
But I'm like, okay, but then it's unregulated stuff that you're putting in. And I think this is where, so then again, we don't become trusted because it's like, well, they can do it. How come they can do it, but you can't?
Yeah, I know. It's tough, isn't it? Because then I see a lot of people in A&E with complications secondary to shoddy jobs.
Yeah.
And I'll be honest, it does annoy me. People going abroad for treatment and coming in with, raging sepsis. I just think and obviously we help them. We want to try and look after them and make sure that they get good quality care. But it is still frustrating that is even a thing.
Absolutely.
Just do it properly. Go see a professional. Don't go to backstreet places where moonshine's getting injected in you.
Which is, isn't it? Okay, so I could chat to you all day. Do you know what I mean? We literally, so let's do a couple of things now some advice. What would I do? What would I be taking? And if someone wants to come on this journey, where they can find you, and what would be obviously the first few things you would say, do you know what? Start taking this. If you've not got time to come into the clinic, what's the one thing that they can do at home?
Sure.
To really start to kind of get on their longevity and health and fitness, wellness journey, shall we say?
Sure. I mean, we run the program. It's called the Never Guess program. So people are guessing with the health. So our Never Guess program just stops all of that. So
I love that. Do you know what I love about your vision for obviously what you do at Healthy? I love the name. Do you know what I mean? The way that you've kind of shortened it. It's cool. It's funky. Do you know what I mean? You go, oh, what's Healthy? I'm going to have a look. Do you know what I mean? Because I think if you'd wrote it just Healthy, you wouldn't have had the impact. Whereas I've looked, and the way that it's wrote,
Healthy, yeah.
You literally come and you go, I want to go and see that. It looks cool. Do you know what I mean?
We're in a trademark battle for it for a while, but we managed to win it. No, we've got it. We've got it.
Congratulations.
We've also got Never Guess. So, but yeah, the Never Guess program, that's where I always say people to start. And often we work through employers. So if we do like our route to markets through like employers. So if you've got any private medical at work, that will fund all of our activity for you as well. So all of the blood tests and scans or whatever are fully funded, which is great. And we can actually support people and it doesn't cost them a penny. So it's brilliant. The Never Guess program aside, creatine is great, provided you have normal kidney and liver function. Creatine really is great. I say that you want to be taking 1 gram per 10 kilos.
I was going to say if volume wise.
Dosage wise, yeah. So I take 10 grams a day. There's no loading. That whole loading thing's kind of out the window now. But I'd say 1 gram of creatine per 10 kilos of body weight, total body weight. So if you're 60 kilos, take 6 grams a day, provided you've got normal liver and kidney function.
So realistically, have a test before you even take that, would you say?
Yeah, most people can get a liver and a kidney test through the GP. That's kind of like a standard test. So, and if you've had a normal one within the last year, you can use that one as well.
Yeah.
So that does make it quite accessible, which is great. And I would go for unbranded creatine monohydrate powder. You don't need to buy brands. You don't need to buy flavored shite. Just get yourself a bog standard creatine monohydrate powder.
Yeah.
That seems to be like the best and purest form across the board. The other thing that I see all of the time, especially in Britain, is vitamin D deficiencies. I don't know if you are deficient, but I see it very, very regularly.
Yeah.
Again, this is where the testing is going to come in, that sandwich of test, replace and retest. But yeah, understand your levels. My target is 150. The NHS target is 50. They want you above 50. People are still kind of deficient if they're under 120.
Yeah.
So I set our target at Healthy at 125.
So a lot of the symptoms of that is quite fatigue and...
It is, yeah. Vitamin D is a hormone, plays vital aspects in loads of different parts of your body, but especially for women coming up to menopause as well, they really, in terms of looking after your bone mass, vitamin D is essential in part of that process. So I would say get your vitamin D checked and replace accordingly. So I normally start people on 4,000 international units, which is a way above guideline, but the actual evidence is there for 4,000. Personally, I take 8,000 a day because I've done the test, replace, retest, test, replace, to the point where now I'm at 125 and I know what I'm doing.
And a supplement of that or powder again?
It's supplement, yeah. During the summer, I drop it down to 4,000, but during the winter, I'm on 8,000. It's a capsule. It's a good. I won't mention brands, but if you come into our clinic, I send it to you in the post.
Perfect.
Send you the stuff that you need. But again, we're checking the levels because what I want to make sure that we don't bump you up too high, because if you go over, then we're getting issues there as well. So this is where that sandwich just adds that layer of security. The other thing that we check is like your B12, your ferritin levels, which is your iron stores in the body. And again, then we adjust it. Ideally, we adjust it naturally, so through nutrition or through sunlight exposure or whatever. But if we can't do that, that's when we do look at either medications or supplements. But yeah, that creatine, vitamin D, and the other big one that I prescribe all the time is omega-3. The capsules and the tablets typically work really badly. So if you're on a tablet or a capsule, it's probably having very limited effect. Yeah. And that's because it's stabilized with vitamin E, so it doesn't get absorbed. Yeah. There's devils in the detail with all this stuff.
Well, people wouldn't know this stuff.
Yeah. With your omega-3s, the key ones you need are the EPA and the DHA. The ALA is the plant form. And apart from during pregnancy, your ALA doesn't really get transformed or converted into the DHA and the EPA. During pregnancy, it does because it's so essential for brain health for the infant, so that your body actually changes its pathways, which is interesting. But yeah, I would go for a high quality omega-3 oil. Some of them have vitamin D in as well. Again, I won't mention brands, but if you go into clinic, I can just give you stuff.
Great for skin.
Yeah.
Do you get when you kind of skin health and everything when you're doing your omega-3s?
Yeah. And if you're getting enough from your diet,
Yeah.
then great. You know, if you're having enough oily fish whilst watching the mercury content in the fish, then that's great. You know, you can ideally do you get it from natural sources, but it's a lot of fish that you got to eat. So most people don't get it in which case they're like the top 3 things that I prescribe all the time.
Perfect.
Provided everything's safe and, you know, it's clinically indicated.
Yeah. And like you say, do you know what I mean? When you are going to someone like yourself, it's not over-consumable either. It's literally the right things
for your body
that you're giving.
It's not rocket science.
It's not 100 supplements that you see.
Go back to Boots where we started the conversation. We were doing those videos the day of like, and I think it was like nearly 200 products mentioning energy, and they've all got different vitamins and stuff and different compounds and blends. That's the other thing. I wouldn't advise blends. Anything that is a blend, avoid it because it needs to be specific to your body.
Yeah.
Do you need vitamin A, B6, D, and do you need all of it in that blend? And then if it is a blend, it's probably going to be under the amount that you actually need. So like the levels might be way too low. We then can't tailor it. So like if we are rechecking, we then can't just add in a bit more vitamin D, for example.
Yeah.
You're increasing the amount of all of those vitamins. So yeah, blends, again, like there are supplements like the greens powders and so on, but you're just like, what are we doing? So yeah, target it. It's based on your body.
It's a shame that we've got to wrap up because I probably would have come across to like the matcha trend and everything there because that's another conversation again. But thank you so much. Probably have to do another one because honestly, like it was incredible that, you know, there's so much information there that people can take away, educate themselves on and stay away from.
Yeah. Well, thank you, Claire. It's been great.
No, thank you very much. I appreciate it. Thank you.
Nice one. Cheers.